The last 5 years have seen major changes and intense debates on drug policies in South Africa. Now, these include the decriminalization of cannabis use through a constitutional court judgment. But many say locally, drug war rhetoric still dominates, with the justice system accused of overusing arrests and detentions to tackle drug use, which is essentially a social and public health problem. To explore this topic further, I'm joined via Zoom by British Academy Global Professor in Criminology at the University of Manchester, Professor Julia Buxton. Professor, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Thank you. Thank you for having me.
First of all, let's discuss the impact that the war on drugs has on national governments.
I think the key thing really to understand here is that all of our countries, whether you're in Britain, Bulgaria, South Africa or Tajikistan, we're all bound under a common international system that criminalises illicit drug use. And the key problem here is that this system, this drug policy, is simply not working. Criminalisation targets marginalised groups. It doesn't enable us to reach people who are really experiencing all forms of stigma. And what we end up with is a system which is really a driver of ill health and disease. And we really need to change the way that we approach drug policy.
Do you think criminalisation of drug use is the answer, though? And if not,
Absolutely
what could be the other alternatives?
Sorry to cut across you there. Absolutely not. Criminalisation is a system that we've had in most of our countries since 1961. We've had over 50, 60 years of a strategy that has fundamentally failed, which has led to huge over-incarceration, grave violations of human rights, and which directs all of the funding for drug policy towards the police and the security sector, when really this money needs to be going into health, development and education. So instead of criminalisation, we think it's urgent that we instead look at different forms of regulation of substances.
Okay, now there's a growing consensus, Professor, that the use of drugs cannot be seen in isolation from the living conditions in which people find themselves in. I mean, there's a wide-ranging literature on this particular matter. So can you categorically establish a link between people's living conditions and drug use and the different types of drugs and drug use?
Well, the data that we use is from the United Nations Office on Drugs and Crime, the UNODC, and this shows that the majority of people who use illicit substances do so moderately and without harm, in much the same way that the majority of people who consume alcohol do so moderately. Our concern is with the majority of people who have existing problems of trauma, abuse, neglect, economic problems, which in turn is feeding into cycles of problematic drug use. If we're to really address these challenges of problematic use, social marginalisation and stigma, then we need to change drug policies, but we also need to look at other forms of ensuring that people have their human rights and their right to health recognised and respected. And in particular here, we need to be thinking about people who not only consume drugs, but also, in a really important issue for you in South Africa, the cultivation of drugs. The cultivation of cannabis, daga in South Africa is a subsistence economy for many people. People cultivate these drugs because they have no alternatives. We need to start providing meaningful alternatives.
Yeah, I'm actually glad that you touched on the decriminalization of cannabis use in South Africa. So much has been said about this particular matter. And do you get a sense then that in as much as it is decriminalized in South Africa, it does remain a public health problem?
Well, it does, because my colleagues who I work with at the University of Pretoria, who've written extensively on this, Sean Shelley, Andrew Scheiber, they point out that this has been a very limited form of decriminalisation in South Africa. Fundamentally, the changes that we're seeing introduced do not really align South African drug laws with the Constitution. So we really need to see this state of South Africa emphasising rights, having a rights-based approach. It's not good enough simply to allow a couple of cannabis plants in an individual's home when we know that the fundamental inequalities of drug policing will impact the poorest sectors of South African society rather than the wealthiest. So we actually need to look at a far broader system of reform than a very, very limited decriminalisation of cannabis.
Because obviously you may be aware that there's a danger of, abusing cannabis or marijuana, and that it may not necessarily be used for medical use, but then for other use as well. So how then do governments track the usage of cannabis?
Well, at the moment, it's very difficult for us to track the usage of cannabis, as it is with all drugs, cocaine, heroin, anything, because when a drug is criminalised, It drives populations underground. Epidemiologically, it's very hard for us to study the impacts on people's health, mental health, psychological health of using illicit drugs. So I think what we're really emphasizing, we've just published a book with colleagues in South Africa on drugs and development. What we're really emphasizing here is that in order for us to understand the effects of cannabis, which is a drug which has been used for centuries, this is not a new drug. And overwhelmingly, it's used, as I said, without major problems. But for us to be able to better understand cannabis, we need to be able to do better research. And that's very difficult for us to do under current circumstances.
Professor, is it correct to say that the domestic war on drugs has certainly contributed to an increase in drug overdoses and sort of fostered the sustained the creation of powerful drug cartels?
Absolutely. When you criminalize something, then essentially all you're doing is creating an illicit market. Organized crime, low-level crime is really thriving in the context of criminalization. So if we want to address these overall levels of criminality, then let's not help organized crime. Let's not give them something which is of value to their crime portfolios. Let's change the way we understand and engage with drugs in order that we're not facilitating crime. In terms of overdose, I live in the United Kingdom. And here we're having the 7th year of the highest levels of drug overdose. It's an absolute scandal in this country, but we're having overdose because criminalization makes drug use dangerous. If you have pure forms of MDMA, cocaine, heroin, in a pure form, these are not dangerous substances. They're pharmaceutical substances. It's when you criminalize that you allow adulteration, very, very harmful injecting and drug use practices. And that's when we have the risk of overdose, as we can see in places like the United States with the horrific levels of drug overdose that they're suffering there.
And an argument has been made that the justice system is often accused of overusing arrests and detentions to tackle drug use. I mean, a criminal activity is just a criminal activity, no matter the circumstances, Professor, isn't it?
Well, I think your questions here are very nuanced and very smart. And the way I would certainly respond to that is criminalization and policing are very important. How we police people is what matters here. And what we see in terms of drug policy is that those people who are over-policed, those people who are particularly targeted by police, it's not white, elite, wealthy people. It's overwhelmingly those, particularly in my own country, around the world, it's overwhelmingly those who are the low-hanging fruit, the easiest to arrest. So policing is deeply problematic because of precisely the communities that it is targeting at.
And I guess so many governments are often found with the burden of juxtaposing the public health concerns versus the economic effects of drugs. I mean, so many people, we know that they've made a living out of selling illegal drugs on the street. So what do you make of that juxtaposition?
Well, I think we have to be very careful in understanding why people are engaged in selling drugs. A lot of the evidence that we've collated in a couple of recent book collections that we've done is that people are involved in selling drugs on the street to buy shoes for their children in order to be able to ensure their children have an education and that they can pay hospital bills. Where we have weak welfare, weak safety nets, then selling drugs becomes essentially part of the informal economy. People do this in order to survive. So when we're talking about street selling, let's be very clear about why people are street selling. This isn't always about people driving around in large, flashy cars. It's not always people who are profiting like that. People are involved in these informal economic activities for subsistence reasons. So absolutely the government has a responsibility to ensure that criminalisation and the negative economic effects of drug policy are not feeding through into our societies. But the only way we can do that is by a radically different approach towards illicit substances.
Well, political and economic think tanks think that there is economic thinking, of course, offering valuable insight by examining just how drug prohibition alters the incentives faced by individuals on both the supply and the demand sides of the illicit drug market. So, in turn, Professor, should we look at it in a way that allows us to trace the chain of consequences associated with drug prohibition?
Oh, I think that would be an absolutely fantastic piece of research to be doing, and we are seeing some very, very important innovations and policy changes. Portugal, the Czech Republic, Switzerland, a large number of states in the US are changing the way in which they approach drugs. They're leading on a health-based approach. They're prioritizing public health rather than trying to understand drug policy through the lens of crime, violence and security. And once we start emphasizing that we want to achieve public health outcomes, then that fundamentally reframes the way that we target and direct the drug policies and the way that we want to see that these illicit substances dealt with in our societies.
All right, Professor, great chatting to you. Thank you so much for your valuable analysis. We do appreciate it.
Thank you very much for having me. It's been a pleasure.